Hey everybody, welcome back to MedEd Insights, the channel dedicated to helping you get through medical school, residency, and more. My name is Brian and I'm a second-year physical medicine and rehabilitation resident at Mayo Clinic. So I'm over a year into having this YouTube channel and I feel terrible that I have yet to make a video just about the general overview of what is PM&R. And so without any further delay, today's video is going to be dedicated to all about this amazing field that I chose to dedicate my career to. So stick around if you're interested in hearing more about what physical medicine and rehabilitation is all about. So you'll hear it referred to a number of different things in the hospital, either PM&R, some people will forget about the and just say PMR, you'll hear physiatry or physiatrists, or physical medicine and rehabilitation. The specialty has its roots sort of back around the time of the First World War, whenever there were a lot of injured veterans coming back who needed rehabilitation as a result of their injuries from the war. Eventually, this got merged in with the doctors who were doing more physical medicine and became what we know today as physical medicine and rehabilitation. Now, the field itself is super broad, but the general description that I like to give people when they ask what it is that we do is it's a field where we learn about the neuromuscular system and particularly how it relates to patients who have disabilities so that we can treat and manage our patients in order to improve their quality of life and overall function. And so I like to think that we're in a sense function and quality of life doctors the same way that a cardiologist is a heart doctor. All the patients that we see have some sort of injury or some sort of disability that's affecting their overall movement, function, and quality of life, and it's our job to learn about how to diagnose and manage those conditions. Now, these disabilities can be anything from a severe to a quadriplegic with a spinal cord injury, all the way to just your weekend warrior who has a torn rotator cuff from shoveling too many leaves. I think the unique thing about our field is that everything we're doing and everything we're involved with our patients is all centered around their function. One of the more simple ways to sort of think about what we do in our field is think of like an orthopedic surgery practice without the surgery. So we learn about how to take care of and manage those same sort of conditions, except in a non-operative manner. Whereas the rehabilitation side of our field is all about rehabilitation medicine, and particularly patients who have had things like traumatic brain injuries, strokes, and spinal cord injuries. Now, how do you become a physiatrist? So in order to go into physical medicine and rehab, you of course have to complete undergraduate, medical school, and then get into your residency. Residency is in total 4 years in length, and this involves an initial preliminary year that can be either a transitional year or a prelim year in internal medicine or surgery. After that, it's 3 dedicated years of PM&R residency, followed by a fellowship if you choose, and most fellowships aside from pediatric rehab are all 1 year in length. And these fellowships that you can go into are super diverse. They include things like brain injury medicine, spinal cord injury medicine, sports medicine, interventional pain, pediatric rehab, cancer rehab, amputee and prosthetics. Lots of really cool stuff that helps make our field very diverse and gives you a huge range of options to choose from in your career. To break down the types of practice settings, there's essentially inpatient practice versus outpatient practice. So the inpatient doctors are going to be in one of 2 settings. They're either going to be working on an inpatient rehabilitation unit, such as a brain injury service or a spinal cord injury service, or they're going to be involved in seeing consults. And so on this inpatient side, you're essentially the primary doctor for these patients who have had some sort of traumatic injury that's resulted in significant debility, requiring them to be in the hospital for rehabilitation. It's your job on the inpatient team to manage the overall group of therapists and staff members helping take care of the patients, but you're also helping to manage all the complications as a result of their injury, and to the extent that you're comfortable with at times, you can function like their primary internist. On the outpatient side, you're typically going to be working in a sort of musculoskeletal medicine setting is most common, where you're basically seeing patients with a variety of musculoskeletal complaints and helping to diagnose, manage, and treat those complaints accordingly. You can also work in the outpatient setting doing things like interventional pain procedures, sports medicine specifically, and you can even do more neuro rehab where you're working with patients in clinics who have things like ALS and MS. If you like procedures, then PM&R has a ton of different really cool procedures you can get involved in. Probably the biggest one that we do is ultrasound guided joint injections, but we also get a lot of exposure with performing EMG studies, which are studies to look at how the nerves and the muscles are functioning and involves a lot of hands-on testing. And you can of course do an interventional pain fellowship, which is essentially completely doing interventional procedures to help manage patients with pain. The lifestyle of PM&R is fantastic. Even if you're working in a busier inpatient setting, the hours are still generally really good, and taking call is also pretty low stress as well. I mean, if you think about it, there's not too many emergencies that happen in rehabilitation or physical medicine. And so while you might be on call in case something medically comes up, it's not nearly as intense as a lot of other specialties. Certainly then if you're working on the outpatient side of things, it's going to be just like kind of general clinic hours. Residency is great. Residency lifestyle in PM&R, at least here at Mayo, is fantastic. We have really reasonable schedules, really reasonable call schedule as well. And so you get a lot of time to do stuff outside of medicine and focus on having a great life outside of the hospital. The kind of bread and butter of what we see is pretty broad, but in general, for the rehabilitation side, a lot of what we see are patients with strokes, spinal cord injuries, and brain injuries. And so we get really good in our training, especially through residency, in how to manage and take care of patients with any of those disabling conditions. The bread and butter of the MSK outpatient side of PM&R is more of your kind of classic back pain, shoulder pain, knee pain, those sort of joint complaints are a lot of what we see in our practice in PM&R. The type of person who I think is a really good fit for this field is anybody who's really interested, first of all, in the neuromusculoskeletal system and managing those sorts of diagnoses and injuries. Of course, if you want to manage them surgically, then you need to look into orthopedics or neurosurgery. But if you're not into surgery but you love learning about that stuff, then PM&R could be for you. I think the other really important thing though is that you have a passion to help people who have disabilities, because that's the majority of what our patient population is. And so I think people who have a particular draw towards that patient population are going to fit in really well within PM&R. I also think people who like to be a little bit more creative and kind of problem solvers also fit really well, because a lot of PM&R is not algorithm based. There are certain things that you know you always have to do a certain way, but there's a lot more room to be creative in terms of how we're able to help our patients based on whatever their unique disability and injury is. So in particular, as a former engineer, I love being able to be more kind of problem solving and critical thinking oriented in how I'm going to help the patient in front of me who has an injury and disability that might be very different from the patient that I saw before. The pay in the field certainly isn't one of the highest as you look across all the board in medicine, but what I think is important to think of is when you break it down in terms of how many hours you're actually working, it's pretty great. And I know personally, I don't really care about having to make like $500,000, and so the pay really doesn't mean that much. In my opinion, it's more than enough. It's more than reasonable for the work we're doing. And when you consider the great hours and lifestyle, it's pretty awesome. So if you're interested in PM&R, I encourage you to reach out to someone at your medical school. If they have a department, try to get involved and shadow them. And don't just shadow or get experience in one setting. Try to get experience in both the outpatient setting and the inpatient setting so that you can see the broad diversity of the field. If you have any specific other questions, I encourage you to check out the AAPM&R website that I'll link below. It has a lot of really cool resources for students. Ask me any questions you have about the field, my interests, what I like, what I don't like, those sorts of things. Also check out, I did a video that I'll link below about why I chose to go into PM&R specifically that has some tips for you. And as always, thanks for watching these videos. I hope you enjoyed it, everybody, and I'll see you next time. Bye.